Then the day before that, it was the top 10 causes of death
Right.
on Guam, and COVID was number three for
Three.
2020.
Right. Yeah. It's pretty alarming there. And so that's coming up at 9. We'll jump on that live stream. Let's head into the KUAM News Zoom room now. We're here to unpack yesterday's Mayor's Council of Guam meeting. The president is also the mayor of PD, Mayor Jesse Alley. Good morning, Mayor.
Good morning. Yeah, we had a long meeting yesterday. It was there was an addition to the agenda at the last minute. The night before, I was contacted by Public Health about the possibilities of the villages hosting the third dose booster shots in the villages. And so, of course, with the approval of the membership, we added them onto the agenda. And it was a first that they heard, the mayors hosting the third dose, but there was no opposition. And so because there was no opposition, to hosting the vaccine clinics in the villages, we proceeded to make sure that the schedule that was presented to us from Public Health was acceptable by the mayors. And we're not having 19 separate clinics. We're going to group together smaller villages so that there's, it's not just one in every village. And the example that I use is the PD Asan Maina. It will be in Asan Maina at the Asan Maina Community Center, but we're encouraging all the PD residents, Asan Maina and residents to go to that one site. And so we should have that list to Public Health this morning, and then they'll work on, pushing that out. So that's going to start next Monday, and it'll run through November. And this will be the first run, and it's for 65 and older. They'll obviously need to show their proof of first and second dose vaccination of Pfizer. But the good thing is that they're finally going to offer testing at community sites. So that's what we've been asking for since the start of our own personal campaign to get tested and to know your status.
Yeah.
So we're glad to know that along with the dose 3, there will also be testing at the site. Public Health will run everything as far as the whole conducting the vaccines or administering the vaccines. The mayor's offices will assist by making appointments using the tiny URL and making sure that we have the facilities ready for Public Health to come in. What we're going to do is the publication will indicate all of the clinic sites, the dates, and the times. And so we're encouraging residents to take a look at the full schedule and look and see where your village falls. And please make sure that you set your appointments at those times. So we're trying to avoid residents from one village registering for, at another village site, simply because we're doing it this way so that you stay within your village. However, no one will be turned away. And walk-ins will certainly be welcome, but making the appointment is definitely going to be a sure thing. That will determine how many doses each location will have at that one time. So it is important once Public Health pushes that information out. It's going to be important for 65 and older residents to ensure that they're registered or they may have an appointment using the online appointment scheduler, so that the mayors know how many doses to request. So the mayors will be handling that portion of the appointment schedule portion, and that's how we're further assisting Public Health.
Right. Can I just go back to the Know Your Status campaign? Right. Unfortunately, we're seeing a lot of these deaths with the elderly. Some of them vaccinated. We have had a few fully vaccinated deaths. But what's the status on that campaign to reach out to the elderly? Did it ever go beyond making the phone calls?
Well, like you said, there were some villages that actually did the house to house. And I know that in one village, they actually created, what do you call this? What is that? The rapid engagement team. Sorry, they actually put that together for this one village because of a particular group, an isolated group, or a cluster of families that were, had a situation. And so I know because of our phone calls and because of the visits, public health has been able to, identify again those isolated areas or those problematic areas, and we were able to provide the testing and subsequent vaccination, I think, for some of them. So I don't have black and white data on how every office conducted their campaign.
Yeah.
But I do know that every office, in one way or another, reached out to their residents, whether
Right.
it was by phone or.
What I like to see, Mayor, and I don't know if you have this data, is actual, tangible, how many phone calls resulted in Tunwan going to get tested, or, that's what I like to see.
No, that wasn't we did not have a full-on campaign in that manner where we actually had, where we could actually measure the results, unfortunately. This was all kind of done real quickly, within a matter of days. We just, started. As a matter of fact, we met one time with the physicians, and then the following day we just started calling, because at that point it was important that we just get the word out and get as many people tested as soon as possible. That was when we were seeing the rise and the increase in dead on arrivals.
Right. So
don't that I mean, by looking at the chick, right, that kind of has curbed a little, but we can't measure how well and how productive our work was based on the numbers that we're currently seeing.
Yeah, so that's why I was asking, and don't take it the wrong way, because I know, the effort is definitely there, but when you look at the numbers, the DOAs have tailed down a little bit, but nothing has really changed. So do you believe that this effort that you guys are doing has made an impact?
No, well, yes and no. And my personal opinion is that vaccination is important, and we have pushed that from the very beginning, and we continue to push it at all avenues. And I even have doctors in the village who continue to encourage us to have everyone vaccinated. But like Chris said, I mean, we're doing the same thing, we're pushing the same thing, and we're not getting any, the results are the same. And so I'm just afraid that because we're calling, that's still a different message from what the JIC is reporting and what public health is saying and what the administration is pushing about just vaccination, right? I mean, we're almost all vaccinated and we're still seeing high numbers. So is vaccination the only, is that the key? Should that be the focus? I mean, if we're 90% vaccinated and we're still pushing vaccination, but we're still dying and still getting positives, vaccinations, again, personally, and I'm certainly not a doctor, I mean, it just kind of tells you that you need to focus your efforts on something other than vaccination.
Right.
And you hear the doctors talking about, if you're not feeling well, go get checked. And I have to say, though, that there are definitely residents out there who, where we live in a society that, I don't want to say too much about it, but as a Chamorro, you know what to do. You know when you're sick, and you go to the doctor when, I'll go to the doctor when I'm almost dead. I mean, again, that's my personal opinion. Yeah. But in this, when this medical crisis, you can't wait until you're almost dead because you'll be, it'll be really bad. Yeah. So the moment you feel sick in any way, fever, cough, just not feeling well, you need to go get checked. Yeah. And I just feel like we need to push that out more. And are we seeing more people going? I think we are seeing more people going to the clinics because we still get calls about getting charged, questions about fees, and so there's still an active, or there's still some awareness about getting checked before it's too late. But perhaps I think we need to change our efforts and push more of know your status and get checked.
You know, all the questions you brought up about why is it we're 90% vaccinated and we're still seeing this craziness. That'd be a great question to ask the governor in like a press conference type setting. Because that's a big question a lot of people have. I mean, we'll ask Dr. Ann during this, if we get the opportunity to ask those questions. But yeah, and I think that's maybe kind of why we've hit this backstop with the vaccination is people just need it to be explained to them, right? I mean, they should just be honest. I mean, does the vaccine work? Hell yes. Yeah, it does. You're good. You take that shot, you're good for like 3, 4, 5 months. Then you get a little, booster or a third shot or whatever they're calling it. And for the most part, you don't end up in the hospital, right? So that should have been the message. It should have never been that, oh, if you get vaccinated, you can't pass the virus, because that's totally false, right? And I think that's why we've just got this last little bit of the community that
well,
unless
I think what we're seeing is a lot of earlier on during the springtime, if we want to use that, a lot of the push was if we by July 21st if we reach herd immunity, we could live our lives almost normally, right? And that was the push. So we got to 80%, we got to 85%, and we're dying more, right? And
yeah, that's a real big switcheroo, I'll say, Mayor. That's a real big switcheroo, and any reasonable person would have an issue and question that. Anybody would question this, right? And you're right. And people say, oh, we're moving the goalposts, and I don't think it's intentional that they want to keep us in this state. I just think it's just the nature of the virus, right? I mean, we were told you get this and you're right, we're going to go back to normal. Well, we got it and then some, and we ain't nowhere near normal. So yeah, these are good questions.
Yeah, and honestly, for me, again, I'm not the doctor, and I'm certainly not a professional in all this. But what worries me, and you guys talk about it all the time, is when I take a look at the JIC report and I just figure out the percentage of positives. I mean, we have been at double digits for too long, and it's
triple digit.
Oh,
double digit positivity, right? Yeah.
Right, double digit positivity, correct.
Mm-hmm.
So, but yeah, I mean, it's like when you look at that, I mean, most people still don't understand what the CAR score is, and so, but if you just take a look at positives and all that, and the deaths, I mean, it just you just have to kind of need to use some kind of common sense.
Well, there was a town hall meeting that the Department of Public Health hosted with law enforcement and the judiciary yesterday, and Dr. Annette David actually did a really good presentation. And a part of that presentation on COVID, there was a part where she was talking about layering our protection, and she laid out like the 4 different things, right? Preventing exposure, like stay at home restrictions, prevent infection with the vaccination, the physical distancing, the wearing of the masks, then preventing the disease with the monoclonal antibodies and vaccination, and then preventing death. Again, that's vaccination, proning, ventilators, other therapeutics, and ICU care. But part of her presentation, she also said that no single intervention is 100% effective, and it has to be kind of like all together. But primarily, she did say vaccination. So, I mean, if people would like to watch that, it is on Public Health's Facebook page. She did a really good, simple, easy to understand breakdown of COVID.
Yeah, so actually, I heard her because she lives in PD.
Okay.
Yeah.
But yeah, and if anybody's ever seen her presentations, it really is just it's not difficult to understand. She lays it out really well. So yeah, I think that I'm going to actually watch the whole thing. I was watching some of it, and then I was really interested about the layering of protection and those 4 things that you should do in combination to basically contain COVID.
I agree that it's she's Dr. David's been around for a while, but it's a different. I think people will take to it simply because it's a different format, it's a different person, but she's also But anyway, so
Yeah.
that was definitely one of our big deals on our agenda yesterday. It took up most of our time, but we're definitely happy to know that all the mayors are, well, most of the mayors are okay with having vaccines in their
Yeah.
villages, and so I'll be pushing that out to public health this morning, and hopefully we'll know soon because we're supposed to start on Monday.
Oh,
Wow.
wow. So yeah, if you could
Yeah.
also, let us know about that. I'm not
Yeah.
sure.
As soon as the schedule is finalized
Mhm.
with well, it's finalized on our end, but I need to send it to public health, and they need to figure out that it's going to be okay on theirs.
Mhm.
Then we'll certainly have that ready to go.
Well, Mayor, we
So
gotta
it's-
jump into this public health.
yeah, go.
y-
Call me back later.
meeting.
Okay.
Will
yeah,
do.
yeah. No, we want to talk to you about the Foster Family
Yeah.
Project too. So maybe
Yeah.
next
Oh,
on
okay.
Monday we'll catch you on Monday.
Okay, yeah,
Yeah,
sounds
that's
good.
that. Okay, Mayor.
Thanks,
Okay,
Mayor.
adios.
All right. Sorry about that.
8:59. Quick break, and we're coming back. We're going to live stream.